Hi, good afternoon, everyone. Welcome to our monthly awareness talk and workshop for My Story. Okay, so before I start, let me briefly talk about who are we, My Story. My name is Charlie. I'm the host for the workshop today. Awareness talk. So, My Story, basically, we are a special needs center where we provide services like for those children who have experiencing academic delays, sensory delays, developmental delays, behavioral and emotional difficulties, as well as physical delays. Okay, so we are a multiple disciplinary team. So our team consists of special needs teacher who are doing academic support, behavior therapists for behavior therapy. We have a clinical psychologist to do diagnosis, screening for children with special needs. And then we have a counselor for counseling and also provide guidance for parents. We have occupational therapists, reading therapists, as well as physiotherapists. Okay, so you can contact us at our WhatsApp number. You can also email us at mindstory@mindstory.com.my. And our operating hours is Monday to Fridays, 8 a.m. to 5 p.m. We are open on the weekend, but by prior appointment only. And we are closed during public holiday. You can check us out on our Facebook at mindstory.my, our own website, Instagram, and LinkedIn. So by following us on Facebook, you can check out the latest events. Every month, we will run about 2 to 3 awareness talk or workshop. We invited speakers from different health professionals, as well as our in-house therapists will come and share and talk about what the topic that regarding children with special needs. Okay, so for the topic today, we're going to talk about eye care. Recently, I've come across a lot of parents have concern on vision. Okay, so from then when we talk about vision, we always talk about like optometrists, okay, specialists that work with eye care, eye vision, okay. We like parents are concerned that they brought up to me that makes me uh, uh, go around and look for alternative for parents. So one of them is by having inviting a specialist who talks about eye care and vision. So because when we talk about eye care, vision is something that when it comes to specialties, it's something that we hardly talk about, and we have opportunity to do this, and we are quite happy that we are able to invite a specialist from UKM. Dr. Zainora will be joining us today. She is one of the optometrists in UKM. Okay. Later when she's here, we'll invite her to share about what an optometrist do, and she can go through with us the common eye problem and how to take care of our eyes. Uh, Hi, Dr. Zainora.
Hi, how are you?
Good, good. So, yeah, so today we have a person who are specialized in eye to share a bit about how do we take care of our eyes and also some of the vision problems. Okay, so throughout, since end of last year and about a few months ago, these are the concerns that parents have bring it up with me. So I thought about why not we invite someone to talk about eye vision care. All right. So okay. So today we have Dr. Zainora from UKM. She is the Ketua Program of Optometri with UKM. So good afternoon, Dr. Zainora.
Good afternoon. Can you hear me
Yes.
clearly?
Yes.
All right, good.
Doctor, we can start when you're ready. Yeah?
Yes, I think we can start now
All right.
if you want.
Yes, we can.
So should I share my presentation now?
Yes, please.
Okay. Okay, can you see that?
Yep. Yep. So for those who just joined us today, you can post your question on the comment. So after the talk, we will go through a Q&A session. That's where Dr. Zainora will answer your questions. So yes.
Okay. Okay, shall we start now?
Yes.
All right. Okay, Assalamualaikum and good afternoon to everyone. First of all, I would like to thank Mind Story for the invitation. I also like to thank everyone who's here today to listen to my talk. I will be talking about eye problem and care for children with special needs. I will divide my talk into 4 parts. The first part will be on a little bit on the introduction for vision and brain. And then I will continue with vision development. I will talk about vision development in the typically developed children so that we can understand what to expect in these children and to see what deviation that you will see in the special need children, and also what to look for if you think that your children have any abnormality in the vision development. Next, I will be talking about vision problem in children. In general, the vision problem in special need children is very similar to what other typically developed children would have, but the extent of the problem will probably be more, and the percentage of specially need children who have the problem will be much higher. And also I will share on the sign and symptom that you could look for this type of vision problem. And last, I will talk about the roles of optometrists, what we do in eye care, and I will end this talk with a short video on Clinic Optometri UKM to share about the services that we provided at Clinic Optometri UKM. All right, so we start with vision and brain. So when we talk about looking at something or seeing, we probably think more about using our eyes to see. But the fact is, when we see something, we need to use both eyes and brain. And because of that, both eyes and brain need to function very well in order for us to see and also to interpret what we see and to react to what we are seeing. So for example, in this picture, if, for example, the baby is looking at the mom's face and looking at some features of on the mom's face. So what will happen is light reflected from the face or from the feature of the mother will actually go into the baby's eye. So 2 things could happen here. First, there could be an obstruction in the eyes. So the obstruction will actually stop the light from entering the eyes. Or secondly, if there is no obstruction, maybe the light is not focused onto the retina, which is the back part of our eyes. And this is probably due to what we call refractive error. So let's say, for example, there is obstruction or the light is not focused onto the retina, then the baby will not be able to see. Next, let's say the baby is able to see or the light is now focused onto the retina and it is not obstructed. the signal from the image that is formed onto the retina need to be transferred or go into the visual pathway and go to the brain for the brain to interpret the signal or the information seen. So in this case, if there is any damage in the pathway to the brain or to the visual cortex, again, although the image is formed clearly on the baby's eye, maybe the brain could not interpret the image and the child still cannot see the object that is presented to the baby. So this is the two aspects that we have to understand when it comes to seeing and the function of eyes and brain. However, in this talk, I will be focusing mainly on the eyes because that is the scope of practice that I'm doing, which is looking at the vision disorder or vision problem that a person could have. So when a baby is born, in the first year of life, the eyes will develop very rapidly. This is because at birth, the eyes is not fully developed, and the development will actually occur in the first year of life up to about 6 years of life. And in this period, we call it as a critical period because at this stage, if there is any obstruction to the input that goes into your eyes that cause the vision to be blurred or the image to be blurred, then the eyes is not guided towards normal vision development. That's why it is very important at this stage of life for the baby to have a good visual input in order for the eyes to develop normally. Now, if the obstruction or whatever that is causing the blur vision is not treated or not corrected, this could result in vision loss. And when you have vision loss, this could have a long-term consequence in terms of when they go to school. It will affect their school performance. It will affect their interaction with their friends. Their social interaction will not be so good, and it will also reduce their self-esteem, and consequently, it will also affect their quality of life. For special need children, these are the children that have the higher risk of having ocular disorder, as I mentioned before. Although the typically developed children could also have vision problem, the percentage of having vision problem is much higher among the special need children. And because of that, they would have higher risk of having vision impairment. And on top of that, some of the children might also have some underlying brain injuries, which could also affect their learning ability and also cause other sensory impairment. So I will go through some of the visual development that will occur in children in the first 6 years of their life, and to see what is meant by normal visual development and what to look for if the child might have some vision disorder and the visual development is not normal. Okay, we start at birth. At birth, we know that a baby has very limited vision, but the vision will actually develop very quickly. The eye structure will develop very fast within the few weeks of their life. And by the time they are 8 to 12 weeks, they should be able to follow people and moving objects. And by the age of 4 to 5 months, they will be able to coordinate both their eyes, meaning that they will be able to do a good teaming between their right and left eye. And both eyes are working together quite well by the age of 5 months. Because of that, if you present to the baby object at certain distance, they will be able to grasp the object because they will be able to judge the position of the object. So at this point of time, they should start be playing with their hands, and they would have they will develop the eye-hand coordination. This is a very important skill that they need to develop, because that gives you what we call the spatial concept, in which they will be able to relate between their eye and their hand, and understand the relationship between the two. Now, what to look for when you have a problem at this stage? There are a couple of things that you probably can look for. The first one is whether there is a presence of cross eyes. If you see that the baby eyes is turning inwards or onwards, in the first 2 months of their life, that is quite normal, because they are still developing or coordinating the two eyes. However, if this persists, then it is something that need to be looked into. The other thing that you could look for is whether one of the eyes is having poor vision. Sometimes only one eye could be affected and the other eyes is good. So the baby tend to use the good eye in order to see. So how do we test for this? What you could do is, you could try cover the eye alternately between the right eye and the left eye. And when you cover the eye with the good vision, you will find that the baby does not like it, and they will try to tilt their head in order to see, because you are covering the good eye and they couldn't use the poor eye to see. So that can be one indication that maybe there is some visual disorder or some kind of problems that need to be checked. Next, for the 6 to 12 months of their life, now they are developing even more. They will start to recognize family members. They will be able to see at a further distance. If you are sitting or standing across the room, they will still be able to recognize you. So no longer that you need to be very close to them in order for you to see them, or for them to see you. They will be able to react if you smile, if you give or pass object or food to them. They will be able to see that, and they will react by grasping the object. They will try to hold on to the object given to you, given to the baby. And what sort of disorder or deviation that you could look for? Number one is you can see whether the baby is not responding to familiar faces. So you can actually test both their vision and their hearing. So for example, if they react to familiar voices, meaning that they recognize the voices, however, when you don't speak, they don't give the similar reaction, then probably they will not be able to see the face very clearly. Another thing is to see if they're able to pick up small object. For example, if you're giving a small food, small breadcrumb or rice, whether they will be able to pick up those food to indicate that they are able to see the object. Next, for the next after the year 3 years old up to preschool, there will be a further maturation of the eye and the brain. Remember, I mentioned about the critical period. This is when any disruption to the quality of the vision that fall into the baby eyes onto the retina would actually impede the vision development. So the vision development could not happen as efficiently as it should be. And when this happens, then it can lead to what we call lazy eye. And I will explain what I mean by lazy eye in the next few slides. Okay, at this stage, babies or toddlers should be able to recognize object and letters. They should be able to play confidently. They should be able to move around confidently because they have improved in the depth perception. So what can you look for at this stage related to the maturity of the development of vision? If they are not moving around confidently, if they hesitate a lot, if they are not responding to you or to the things that you give to the baby, then you could suspect that they might not be able to see very well. For those who have very profound vision loss, they would have tendency to rock to and fro, because that will actually simulate apparent visual simulation. So they feel like there's something in front of them. Okay, now I will talk about some of the vision problem that could happen among children, and particularly for the special need children. As I mentioned, this problem you would see also in the typically developed children, but the extent of the problem would be more when you have special need children. So I will start with refractive error. This refers to the power of the eye. Yeah? So when a person is wearing glasses, like I do, it means that I have a refractive error, which means that if I take off my glasses, I will not be able to see very clearly. You know, just like the image that you can see on the right, those are blur image. So someone who have refractive error will see the object or the image blurry, is not clear. Now, there is 3 types of refractive error that you can see that can happen to anyone. So basically it is divided into what we call nearsighted, meaning that you can see near. In optometry, we call it myopia. So maybe some of you have heard about myopia. The second category is farsighted or hyperopia. And the third category is what we call astigmatism. Sometimes this is referred to as the problem with or blur to glare, but that is actually not accurate. It as actually glare is one of the symptoms that you might have with astigmatism, but astigmatism is actually also a type of refractive error that could occur in us, in children or in adults. So on the refractive error, so I will describe what it means and what are the signs and symptoms that you can look for, and why it is important for you or for the child to be corrected for this problem. Okay, the first one is nearsighted or nearsightedness, or what we call myopia. So as I said, myopia is when you see blurry vision of the object at far distance. Okay, so when you look at something that is far from you and you see the object is blurred, then you might have myopia. Now, because the object is blurry at distance, a child would have the tendency to go closer to the object. And this is the reason why you see some of the behavior in the children in which they move closer to the TV when they want to watch TV because they could not see the TV at far distance, or when they want to read, they hold the book close to their eyes. The closer they move to the object, or the closer they bring to the book to the eyes, indicates that they might have high myopia, or the refractive error is high. Okay. Now, why it is important for you to take notice of this, and why it is important for you to correct this? Because if you don't correct for myopia, especially if you don't detect it at early stage and the myopia progress to a very high power, then the person could have a risk of having other ocular disease. So this high myopia is also associated with disease like glaucoma. Glaucoma is when you have increase in the eye pressure, and glaucoma, as probably some of you know, in the end could result in blindness. Okay, so we don't want our children to be having such risk, because the degree of myopia is not corrected as it should be. Okay, so that's why it is very important for it to be detected early, and also for you to bring for regular checkup once you know that your child has myopia, because we need to make sure that the progression is being controlled to a certain degree. And there are ways in which optometrists can do that. Also, there is risk of having what we call retinal detachment. This is when the retina, which is the back part of your eyes, detach or came off from its original position. This is also worrying, because when that happens, especially if it happened towards the center of your central vision, where it is important for you to see, then it will affect your vision, and it could result in vision loss. And myopia has been researched for a long time, and there are many options that are available that can be prescribed to those who have myopia. The simplest one or the easiest one is for you, or for the baby or for the child, to wear glasses to correct myopia. Okay, so once they wear glasses and they see clear image, that will facilitate the vision development. Next is the farsightedness or hyperopia. Hyperopia, as opposite to myopia, is when the object is blurred at near. So a baby who have hyperopia at a small degree is normal. It is quite normal for baby or for young children to have some degree of hyperopia, and that does not need to be corrected, because they can actually overcome the blurry object at near by accommodating, by using their eye muscle. However, if the degree of hyperopia is very high, is significant, then you need to give a correction to the child or to the baby. Now, because a child or a baby is having difficulty looking at object at near distance, then this difficulty will manifest when they are doing near activities. For example, if they are already reading in their preschool or in school, then they will find that they have difficulty in reading, they get tired very easily, they have headache. So when you see this kind of symptom among your children, then you should take them to the optometrist to see whether they have any refractive error that need to be corrected. Also, those with very high degree of hyperopia have the risk of developing squint and amblyopia or lazy eye. Okay, and again, this hyperopia can be corrected easily by prescribing glasses to the child. Next is what we call astigmatism. So astigmatism, unlike hyperopia or myopia, is when you see part of the object blurry, not the whole object. So sometimes people describe it as distort vision. Astigmatism can occur simultaneously with someone who have myopia or hyperopia. So it can be concurrently that your child have myopia with astigmatism or hyperopia with astigmatism. So again, they need to be corrected for this refractive error, and this will, if it is not corrected, it could result in symptom like eye strain, headache, and fatigues. And again, this can be easily corrected using spectacles. So refractive error is a very important vision problem, especially so in the special need children, because it has been shown clinically that there is a higher percentage of special need children who have significant refractive error. For example, it has been shown from studies that children with Down syndrome, they might have any type of refractive errors. Some of them have hyperopia, some of them have myopia, and also astigmatism. Those with dyslexia is usually or commonly have hyperopia and astigmatism. And also it is common to see in these children to have large difference between the power of the two eyes. This is also something that parents need to look out for, because if there is a significant difference between the two eyes, and let's say one of the eye has good vision. So for example, if your baby have good eye in one of the eyes and poor vision in the other eye, then the baby would likely to use the eye with the good vision and ignore the poor vision. And when they do this for a long period of time, again, this could result in the poor eye to develop lazy eye, okay, and also squint. For autism, studies have shown that they usually have normal vision, and the percentage of them having refractive error is not as high as the other special need children. Next, I will talk about squint, or what we call strabismus in optometry. As I mentioned earlier, squint or strabismus, or maybe not really squint, the tendency of the eyes to turn inward or upwards might happen at the early stage of the baby life. So by the age of 2 or 3 months, you probably would see in some of the babies that they have tendency to turn their eyes in and out. However, if by the age of 6 months, you still observe this turning in or turning out of eyes, then you should bring your child for checkup, even if you think that the eyes is not constantly turning. So for example, you think there are times when the eyes is turning in, but it is not turning in all the time, you should still bring your child for eye examination, because we can also have squint that is intermittent, that happen when they are looking at certain distance, for example, or when they are tired. Okay, so this also need to be checked and need to be given intervention. So if you in doubt about whether your child have a cross eye, bring them in so that it can be checked either by the optometrist, orthoptist, or ophthalmologist. Most of the time, the child might have refractive error along with the problem of squint. So we need to prescribe spectacles to the child. And we also will prescribe what we call vision therapy. If the amount or the degree of squint is not so large, and it can be corrected with spectacle and maybe prism, which I will describe later, as well as vision therapy. However, if the amount or the degree of squint is quite high, then this probably would need some surgery intervention in order to align the two eyes. If we leave the eyes alone, we don't do any intervention, what will happen is the baby will see double vision. Okay, so they will see double vision, and because they are still young, they don't know that they are not supposed to see double vision, and eventually the eye might just ignore the eye with the squint, and they will be using one eye, and the other eye will be a lazy eye. There is also another situation in what we call as pseudostrabismus. So pseudostrabismus is not a true squint, not a true strabismus. This is usually observed in very young baby or very young child when you think that the eyes is turning inwards, but actually what happened is the the eyelid at the nasal part near the nose is actually folding a lot. Yeah? There's a large fold of the nasal part at the nasal part, giving you the perception of as if the eyes is turning inward. Okay, so if you see this at very young age, before 3 months old, that is quite common, but then it should disappear as the baby grow. So if you can still see this, then maybe it is a true squint and not a pseudostrabismus. Next, I will talk about lazy eye. So lazy eye is also another condition which is important because it can be a consequence of uncorrected condition. It can be a consequence of not correcting the refractive error. So the baby or the child need to wear spectacles, but it is not given to the child. Or it could be a consequence of not correcting the squint. And also it can be of other disease. For example, the child might have cataract or congenital cataract. So first, it is very important for you to check the reason for the baby to have lazy eye. Lazy eye means one or both of the eyes not developing normal vision. So as I mentioned, in general, the eye should develop normal vision. Okay, so when the baby reach a certain age of their life, around maybe 2 to 3 years old, they should already be reaching the normal vision. And if this does not happen, and the reason for this not to happen is due to uncorrected refractive error or due to squint or any other visual disorder, then the eye will not be developing normally and it will become lazy eye. Now, as I mentioned, because we have what we call the critical period up to the age of 6 years old, this is when you can give intervention to the lazy eye, and the intervention would work quite well for the eye to develop the normal vision again. So that is why it is important, if the baby or the child have problem, bring it early so the vision could be evaluated and the intervention could be prescribed and start with the child so that the child does not develop lazy eye. So this intervention could come in a form of spectacles if the child have refractive error. If the child have squint and it is large, then it need to be corrected first, or it can be corrected by use of prism or spectacles. And then the optometrist or the optometrist will prescribe what we call vision therapy and eye patch. In eye patch, what the optometry do is they will cover the good eye, the eye that is seeing well. The reason is they want to simulate the vision on the poor eye, on the eye with poor vision. Okay, so when you cover the good eye, the child is forced to use the eye with poor vision. Of course, in the beginning, they will not like it because you are covering the good eye. But eventually, if you keep on doing it, the child will develop normal vision and be able to equalize their vision on both eyes, and they will not have any problem anymore. Strabismus and amblyopia, or this lazy eye, is also common among the special need children. And as I mentioned, this can be corrected either using surgery or spectacles. And for amblyopia, we will prescribe eye patching after we have corrected the refractive error or after the squint or strabismus has been corrected. Another aspect that is also important for us to check is the eye teaming or eye coordination, the coordination between the two eyes. This is what we call binocular vision, and binocular vision is very important because it is related to your ability to see, to do judgment, depth perception, and for you to do other activities like reading. I only put up two of the most common vision problem that could have occurred as a result of abnormality in the binocular vision. The first one is what we call convergent. Convergent refers to your ability to focus to the near object, how well your muscle can work in order to focus and make the near object clearly, and it is related to the eye muscle. Now, when someone have difficulty doing this, and when they try to focus at the near object, for example, when they want to read and they try to focus and they're having difficulty doing that, this will manifest in terms of eye strain, headache, and eventually they will see double vision, because they cannot team the eye or they cannot coordinate the eye anymore, and the eye will just deviate back, and they will see double vision, and they will feel fatigued or tired even for a short period of reading. So they can only read for a very short period of time, and then they will not continue because of the symptoms that they are having. Whereas accommodation is actually referring to the ability to focus and also to maintain that focusing for a certain period of time. And also the ability to focus and changing focus when you are looking at something near you and when you are looking at something that is at far distance. So someone who have difficulty maintaining this focusing will have some problem when they are try to perform some of the near activity like reading. So for binocular vision, the treatment that we will prescribe to the patient would be in a form of vision therapy. Another topic of interest is probably cortical vision impairment. So this refers to the vision disorder in the visual pathway and also in the brain that affect partly or fully on the child vision. However, this cortical vision impairment is a very specialized area, and I myself is not trained in this area as an optometrist, and there is quite a limited number of people that actually train for cortical vision impairment. And in clinic optometry, unfortunately, at this point of time, we don't have anyone who actually specialize in this particular disorder. So CVI or cortical vision impairment is common, especially among the cerebral palsy children. And these children could also have vision problem in a form of refractive error. They might have visual field defect, meaning that they will not be able to see the whole world fully. There are parts of their world that is that they will not be able to see. And also they might have some dysfunction in the accommodation or in their binocular function. Because of all this, they will have difficulty in recognition of people, to recognize facial expression, and visual field defect, and also disorder in the visual pathway will also affect their ability to recognize shapes and to do orientation. And they also might have difficulty or inaccurate visual guidance, meaning their vision will not be able to guide the other parts of the body in order to make accurate movement. All right, so next I will go to the role of optometrists in eye care. So basically what we do, or who are we? Optometrists are the primary eye care. So we are the first point in which a person who have vision problem should come and have their vision examined. So what we do is we examine for vision, we assess for ocular disorder and abnormality, we prescribe spectacles, we will also prescribe vision therapy and also rehabilitation therapy or vision rehabilitation for those who have vision impairment. So basically there are 4 parts of our job, to put it simply. We do comprehensive eye examination. From the examination, we will prescribe in terms of optical devices, and this could come in terms of spectacle, contact lens, and other optical devices that I will explain in the next slide. We could also give a child or a person vision therapy as well as low vision rehabilitation. Okay, for eye examination, these are the things that we do during the eye examination. So when you bring your child in, we will check for the eye power. That's the first thing that we will do. We will determine whether the child have any refractive error and what level of vision that the child have. Then we will check for the eyes coordination and visual system. When I talk about the binocular vision, whether the 2 eyes is working well together. Next, we will check for any anomalies in the eye structure. We will see if there's any presence of abnormalities in your eyes, maybe at the anterior, at the front part of your eyes, at the back of your eyes. Then we will make a diagnosis and make a recommendation of treatment based on the diagnosis that we make on the based on the examination that we have performed. From there, we will prescribe either spectacles or optical devices to improve your vision, or we will prescribe vision therapy or vision rehab. We will also refer you to other healthcare professionals. So we might refer you to ophthalmologists if we detect any abnormalities in the eyes that need further investigated, or whether that need to be treated with medication or surgery. And we also refer you to occupational therapies for visual skill development and all that. Okay. These are some of the examples of the intervention that we can give to the child that come to our clinics. So first, the most common one is in a form of spectacle glasses. Yeah? So that can come in many forms, yeah, depending on the refractive error. It can be a single vision, bifocal, multifocal. And we also prescribe specialty lens for a very specific visual problems and special prescriptions. Okay, so sometimes if you go to the optometrist in the private practice, they might not have enough experience to prescribe specialty lens and give special prescription. So they might refer their patient to us for us to be able to prescribe specialty lens and special prescription. We also prescribe contact lenses, and contact lenses can be just a normal contact lenses, or it can be a specialty contact lenses for special purposes. For example, for myopia or nearsightedness, as I mentioned, if the degree is very high and the child is still young and is suitable, we might advise the child to go for a myopia control type of lenses, in which we can reduce the progression of the myopia or the power of the eye. And also we have specialty contact lens for specific eye condition. Now, for example, if your child has certain disease affecting the cornea, then we would prescribe a specific or special contact lenses to help with the condition of the cornea. Next, we also have Prism. Prism is mainly prescribed for treatment of squint. So Prism is usually incorporated into the spectacles, and this is given if the degree of squint is not large, and it can be corrected using Prism. Or in cases in which we detect binocular anomalies and the person is seeing double vision. So we will prescribe Prism in order to fuse the image so that the person can see single image. Next, we also give low vision devices. These are actually special devices, for example, in a form of magnifiers. And this is given to the visually impaired children to enhance their vision. We also give eye patching to help with children with lazy eye. In this case, as I mentioned earlier, we would cover the good eye with the eye patch for a certain period of time in a day, and the children need to do a certain visual activities in order to simulate the eye with the poor vision. And lastly, we also have vision therapy. These are eye exercise that helps to develop normal visual skill and binocular vision. And this can be given in conjunction with spectacles or eye surgery if needed. So why it is important for you to bring in your child for early eye examination? Because undiagnosed or uncorrected visual disorder will result in poor school performance. It will affect their learning ability. They will have difficulty in reading and writing. They will also have social challenges. They will feel isolated because of their vision and because of their inability to interact. They will have, and if this is not corrected at the early stage, it will result in poor outcome of vision, or if there is no intervention at all, this will result in vision loss. And in the end, it will have lifelong complication and it will affect their independency. So when to bring for eye check? So this is taken from the American Optometric Association. If you look at the recommendation is actually very similar regardless of whether your child has a low risk or is at risk of having vision problem. The difference is only that once you have bring the child in to see optometrists or ophthalmologists, then the subsequent eye check will be as recommended, and it probably would be a bit more frequent than what the normally the typical developed children would have to go for. So from birth to 2 years, you should at least bring the child to have eye check between the age of 6 to 12 months. And then from the age 3 to 5 years, they should be checked at least once. If they are at risk of having vision disorder, they might have to come for more eye check because of the intervention given. And from age of 6 to 18 years old, before they go to their school, before entering year 1, they should have their eye check. This is very important because from the age of above 2 years old to about 6 years old, where the critical period is happening, you want to make sure that any vision problem is being tackled and any intervention is given to the child. So before they enter year 1, they should have eye check to make sure that any problem has been intervened. And from there on, they should have annual check, or they might have a more frequent eye check if they are at risk of having visual disorder or vision problem. I would like to share a little bit about our clinic. Our clinic Optometri UKM is situated at Jalan Raja Muda Abdul Aziz, near the Hospital Kuala Lumpur. You can check us on our Facebook and also on our Instagram as shown there. We have 4 optometrists. They are clinicians who are doing a full clinical service throughout the year. And the service that we provide in our clinic encompass of primary care clinic. This is the general clinic in which everyone could come, even if you just want to have a routine eye check. And we have a contact lens clinic. And then we have a more specialty clinic. There are specialty clinic for the pediatric patients. So this is more relevant to the audience today. Also the binocular vision clinic, because children tend to have more problem with their binocular vision. We have low vision clinic, and then we have a specialized service on electrophysiology. So usually for electrophysiology, it is by referral from hospital. We also have prosthetic eye service, in which we provide or we made prosthetic eye in patients who lost their eyes. And finally, we also have mobile clinic that give community service every now and then at certain places. I only show here 2 of the team that we have in our clinic. Actually, we have more team, but these 2 teams are probably the most relevant to the audience that we have today. So we have the pediatric and binocular vision team. A campus of lecturers who specialize in the niche area. So they are trained in the pediatric and binocular field. And also we have 1 optometrist that have vast experience in the area as well. And we also have low vision team, again, who is specialized in the area. There are three lecturers who are specialized in the area, and 1 optometrist or clinician who are trained in the area. So these are the people or the clinician that you would see when you come to our clinic. And last, I would like to share a short video on the service that we provided. Thank you so much for your kind attention.
All right, thank you, Dr. Zainora. It's really it's very informative. So one is now we are open for Q&A questions. I have already few questions that parents asking. But before that, I would like to share also with those who join us today. Sometimes because health, when we talk about children with special needs as a health professionals, there's so many of us try to help the child. So sometimes even me myself recently, that's the reason why I have this talk and invited Dr. Zainora, because there's certain cases where I myself overlook about vision. So, when we talk about special needs, there's so many things that we need to look at. And then after going through with our own team, then only finally we realize that actually the field of vision as difficulty, that's where only I found out that actually uh, they have other alternatives that focus on vision, because normally we just refer to OT, occupational therapists, because they do visual perception tests. But then after screening, then we found out that the root of the cause or the root of the vision problem, yeah, it's eye related. So that's where only we found out that okay, we were supposed to refer to a for optometrist. So like one of the parents asked how often do I check or do I send my child for eye care? Dr. Zainora did share. So from birth to 2 years, at least one, just to screen if there's any difficulties, okay, and then move on from that 3 to 5 years, at least once, and then before school. So this is something that now also we start recommending parents, before you start school, we just want to rule out any visual difficulties so that the scope, the area of issues related to special needs can be determined one by one. Because like for example, Dr. Zainora, you shared about cerebral palsy, Down syndrome, autism, ADHD. Sometimes because and a lot of time when we do one-to-one close contact, we don't really notice that there's a vision problem unless when we bring them into a classroom setting where they cannot see the whiteboard, okay, and a lot of activities they can't really see. So that's where like what Dr. Zainora has bring it out. So when you do your health check, it's every annually. So it's the same goes to eye check. So it's highly recommended. Even just for a normal assessment, like Dr. Zainora said, just go into the clinic and ask request for an eye care. And I also come across with 3PK. 3PK is a government program under Ministry of Health, where they also screen difficulties, children in difficulties among a school attending child. So they also will do similar. They will ask parents to go for a check. If they don't have an optometrist, or then they will refer you out. So this is where the government are doing also raise awareness for parents to, vision is part of the important five senses. But sometimes because when we talk about children with special needs, we are so focused on the behavior that we forgot about other things. So yeah, so there's a lot of government initiatives and been doing it, and UKM is one of them. And if you look for, if you're looking for Dr. Zainora's clinic or the UKM clinic itself, you can raise, because I've been there a number of times. We can just Google or raise it as Health Sciences, Department of Health Science, UKM. Then you can find, because inside the health science building, there's a lot of clinics you can see there. That's where you can look for optometrist clinic. And also, a lot of parents ask me, is there any private practices? Yes, they do. But I would still suggest parents to go government. Why? Because specialists like Dr. Zainora, they have experience, they are a team of researchers and lecturers and also practitioners. They're all in one building. So we don't need to run from A to B to C. Logistically, it will save us a lot of time. We don't need to go from one private clinic to another private clinic. to attend to difficulties. Okay, so if you have any questions, feel free to put in the comment box. So doctor, I have a few questions that I collected while you sharing your information. So one of them asks, what's the difference between optician, ophthalmologist, optometrist, and orthoptist?
Okay. All right, that's a very good questions. And actually, I think a lot of people got confused about these three profession, maybe more confused: optician, optometrist, and ophthalmologist. So I start with optometrists because that's who we are. So optometrists are the one, as I described, is trained for the primary eye care. So we go through 4 years of degree experience as a student, and we are trained to do vision examination, also to do all the other ocular disorder examination and detection. Whereas the ophthalmologists at one end of the spectrum are the medical doctors. So they are actually doctors that are specialized in the eye after they have finished their first degree in the medical field. So these are actually doctors, and that's why doctors are the one who are able to prescribe medication, and they are the one who are able to do surgery. We cannot prescribe medication and we cannot do surgery. But under the purview of the university or hospitals, we can use certain type of eye drops in order to do further investigation on the children, on child. Whereas the optician is probably at the other end of the spectrum. So they are the one, they don't have a degree in optometry, so they probably have a certificates or they have diploma. So their roles are a little bit limited. They do refraction, so they can check for your vision, they can check for your power, but they are not trained in the specialty area that I mentioned just now. So they don't actually learn about the binocular vision, eye teaming. They don't actually, they are not able to see any children under the age of 8 under the law. So under the law, they can only prescribe to those age 8 years old and above for the optician. The other one, optometrists, they are quite different from the three of us. So this again is a very specialized field in which they deal mainly with this person who have problem with the binocular vision. So for example, those who have squint, who have lazy eye, so they are trained in this area. However, there are not many optometrists in the country. There are very, very few of them. And one of them is actually in UKM. And we have maybe like 2 or 3 more outside in the private practice. And they work very well with the optometrists. So we work very well with the optometrists in order to help the patient in terms of squint and also any binocular problems. So those are the different. I hope it clarifies some of the doubts.
Okay, it does make sense. Okay, because I myself also I got confused sometimes. Like parents asking, like, to be honest, it's not my field. I also still in the process of learning, so it's actually quite good. So allow me to rephrase this in more in a way like, so optometrist is like what we know a GP. You know, we go to a clinic GP and then we do a basic screening. And then when the GP refer to a specialist, that's where like ophthalmologist. Okay, so ophthalmologist is like, you know, they do surgery, they correct a lot of things, they prescribe medication for the eye, antibiotics and whatnot. So primary care, so for those who join us today, so this is how am I going to, this is how I explain from my understanding. So hopefully everyone understand how I explain it. So after a GP, optometrist then refer, if it needs surgery, correction, or other treatment, medication, then only we refer to an ophthalmologist. And then optician is somewhat like a technician, if I'm not mistaken. So they can correct certain but very limited, and then like corrective eyewear. So they can prescribe their own like spectacles. So other than that, they also will refer to optometrists or ophthalmologists to further check eye-related difficulties. And then I would say that orthoptics will be like also another very specific area of eye where it's like it's very uh, specific, like like a very sub-specialized area.
Specific condition. Yeah,
Yeah.
very specific condition.
Okay. All right. So that's the difference. Yeah. Because it's good that parents start asking questions because I really I have no idea because normally I would just tell parents, okay, if you have eye problem, you're not sure where to find optometrist, go to your GP. But now with this such information available, it's easier for me to suggest to parents if really field of vision you have difficulty, the first person to talk to is optometrist. Okay. And then those who you can see in the spectacle glasses in shopping mall, I believe some of them, not all of them have optometry, but I believe most of them are opticians because they do equipments for the corrective lenses and whatnot. But very basic, not like what Dr. Zainora talk about the prism. Those are have to be done by optometrists.
Yes.
So parents out there, if you're looking for, like, if you don't know who to talk to and you don't want to go to a doctor, please do find optometrists because like what Dr. Zainora said, look for optometrists to talk about eye or vision, or you are attending and your child is attending an OT session, then you will the OT realize that when they talk about visual perception, they try to do a lot of activity, but somewhat the child has difficulty making judgment of distance or unable to reach out or are not aware of the field area. So this is where you can with Dr. Zainora sharing that now we know we can to see an optometrist. Okay, or those parents with child that attending school, your teacher might the classroom teacher might feedback to you, oh, your child is sitting quite front in the classroom, but he still squint his eye, he still cannot see, and then poor handwriting, like what Dr. Zainora shared, the school performance, like the child seems like unable to copy what he sees on the blackboard. So, and then we are like, after you see different type of therapies that rule out there's maybe no dyslexia and whatnot. So this apply not only to children with special needs, like in general, children, like sitting near to the whiteboard, but yet copying still have difficulties. So this is the time where you might want to check with optometrist to see, to check out just to get a basic assessment, to get a baseline, what your child has, like the eye, how is the eye? Just like every adults like us, we go out to see a doctor, we take blood tests every year just to see the baseline of our health. Same goes to our vision. It's like at least once in 3 years, according to the recommendation, 3 to 5 years, at least one to bring in your child to just get a basic assessment on your eye, so that in the future, if the child has really difficulty, we can sort of like backtrack to the history of the child if there's eye related issues. Okay, doctor, another question that I have is sensitive to light. Is it similar to astigmatism?
Sensitive to light could be that it could be due to various reasons. It could be that there is some what we call opacity in the eyes itself. Something in the eye that is scattering the light. So as the light enter the eyes, there is something in the eyes that make the light scatter, and that could make you more sensitive. Sorry, what is the question again? Is sensitive eyes?
Light, because yeah, is sensitive to light similar to astigmatism? Because sometimes I think because a lot of people, including myself, when we say that we see the light like spreading, we call it astigmatism.
Okay.
I don't,
All right.
yeah.
So astigmatism is actually a type of refractive error, and in some people, when the amount or the degree of astigmatism is quite high, then they will be more sensitive to light because of that. But when you have sensitive to light, it's not necessarily mean that you have astigmatism. It could be due to other cause, like I said. Maybe there are some opacity in the eye that scatter the eye. For example, sometimes you see in old people, they said they become more sensitive to light. It could be an indication of having cataract, you know, where your lens is start to become opaque, and that light that goes into the lens start to scatter, and they become more sensitive to the light scattered inside the eyes. So it's not necessarily due to astigmatism.
Okay. All right. So, to the person that asked this question, so yeah, so high astigmatism can lead to sensitive to light, but it's not necessarily related to astigmatism, but it can be other difficulties that, like what Dr. Zainora said, opacity of the eye that shattered the light when it's get into your eye. So yeah, that's a good question because I think I myself also sometimes like what, like, you know, when looking at the board or when looking at the computer screen, like I like, or maybe the one that I can relate is when driving at night, you know, when I see the oncoming light, that is like the light is not like one dot, it's like spreading out. Then I myself tend to say that, oh, I have astig, I can I can't see now. So now I also learn. It's a good question. I myself will learn it, so I don't simply throw the word of astigmatism out.
Yeah.
Okay, all right. And there's a question about vision therapy.
Okay.
So, okay, so what is vision therapy?
Oh, it depends on what kind of problem that the child have. There are many vision therapy. It depends on what kind of abnormalities that the child experience. Like in the video, I think we show some of the therapy that we did. When you see, you know, there's one where you have colorful beads, and the child is looking at the different beads from different distance. That is one of the therapy. And also, I think you saw something like a card that they put in front of their nose, and they move their eyes according to the dots that they have that they have on the card. Sometimes therapy could be in a form of giving a certain lenses for them to practice their muscle, I mean to strengthen their muscle. So it really depends on what kind of problem, and then we will advise on what kind of therapy that the person need or the child need.
Okay. All right. The next question the person asks is, do you like, let's say, this vision therapy that is provided in the private sector, do they have like qualification to justify that this person is allowed to practice vision therapy?
Okay. For optometrists, those who have degree in optometries, they have learned this in their curriculum, meaning during the teaching or during the learning of the 4 years, vision therapy is part of the curriculum. So if they are qualified optometrists, they should be able to give or prescribe vision therapy to the patient. Sometimes there are also upskilling in the practice of optometry, because every now and then there will probably more research done, and more new ways of doing things, so they could have upskilled themselves with certain certificates and qualification. But in general, optometrists with degree in optometry should be able to give vision therapy.
Okay. All right. So yeah, so for those who joining us today, so please be aware because there's a lot of I've seen a number of vision therapy offered by private sector, but like what Dr. Zainora said, a rule of thumb, the person is practicing in studied optometrist or have a degree in optometry, they are able to do, but the vision therapy is depending on what type of difficulties, eye difficulties. So I understand that a lot of technology from overseas, they talk about changing behavior through eye movement. But like I said, it's better that parents do a background search first before engage in anything. So, but if you're not sure, after doing research, you can talk to your optometry because they are, when we talk about vision, eye, optometrists, or if you know an ophthalmologist, then you can go and talk to them because they are in the field of eye. They know what's new, what type of technology, is it possible or not. Because nowadays, when we talk about special needs, children with special needs, there are a lot of intervention available, but evidence-based or not, we're not sure. So we have to ask the person in that field. Like you have to talk to someone specialized in that field in order to understand more about therapy. Because I've worked with a lot of parents whereby when I hear something is famous and it's workable, then I will go. But that's not necessarily the case. Okay, so to the parents out there, go to the relevant health professional. Okay, especially I'm not very sure with private, but if you go to government, like I mentioned, 3PK under Kementerian Pelajaran Malaysia, they are helping children, school attending children, and they will let you know what are the requirements. Okay, basically like audiologists, optometrists, hearing and whatnot. They will help you to screen through. So sometimes parents quite confused. They come to me like, why do hospital Kuala Lumpur give me a lot of tests? Like 5 different kind of assessment. I said, basically, I tell them this is something that is good. Why? Because they do each of the relevant tests like eye test, hearing test, sensory test, and also physical cognitive test. All this is to find so can rule out one by one. And then when you talk to the specific health professional that doing the test, they will have the not answer, but they can guide you through it. So parents, if you have doubt in like, nowadays a lot of things that relate to therapy, especially for children with special needs. So talk to the relevant. So when we talk about vision therapy, is what Dr. Zainora has explained. So for the question about changing behavior from vision therapy, I'm not sure. There's a lot of things that can be done, but what Dr. Zainora said, it really depends on the type of eye problem. Then they will prescribe different therapy. So some of it, for those who missed out the video, this video will be available on our page. You can rewind back some of the video or some of the example that Dr. Zainara showed. Is like, there's a beads that tied on the string, and then the child will look at the different color beads. So those are one of the therapy that is available. So you can go through that and see. Okay. All right, so we are already at the end of the workshop. If you have any questions that we cannot answer now, yes, you can put it in the comment box, then I'll come back to it. So now we are already at the end of the workshop. Thank you very much, Dr. Zainora, for coming in and share us your experience and information, because this is something that is really important. And coincidentally, March will be a new opening school. So those parents that who join us, if you are concerned, or at least you haven't done an eye test for a long time, you can look up UKM Health Sciences Department of Health Sciences UKM. They are just next to HKL, and then like clinic optometry in particular. This way, if you want to find Dr. Zainora, she's available there. But do call. I believe they can call and make appointment, right?
Yes.
Yeah. So there's few of them there. Not necessarily you have to see Dr. Zainora, but she has a team there that work with pediatric clinic, and also they cover from pediatric to adult, right, doctor?
Yes.
Yeah. So if you like to know more, you can always call them up and make an appointment and go and see for at least a eye test, because now next month, March will be the school holiday before you start school. So this is the time when parents, if you're worried about vision, then you can go for a checkup before school starts. So at least you know that there's no, because post-COVID, there's a lot of things that a child has difficulty with, but some of the things that we can rule out is vision, the 5 senses that is it's quite important to us. Okay, all right. So thank you so much, Dr. Zainora, for joining in today. The information was really good.
Thank you
Yeah.
so much for inviting me. I hope everyone could have gained something from this sharing session.
Yes. Okay. All right. So thank you so much, Doctor. I'll see you next time.
All right.
Bye-bye.
Okay, bye.